So, Dr. Evans, is pancreatic cancer the diagnosis of death?
Absolutely not. Pancreatic cancer is an aggressive disease, but we now have a number of success stories with this disease. In fact, just recently, I think probably about 6 months ago, Dr. Susan Tsai, who is director of the Lebanon Pancreatic Cancer Program here at MCW, looked at our database and I think put this on our website that we now have over 100 5-year survivors of pancreatic cancer just here at the little old Medical College of Wisconsin alone. So I mean that goes to show you that we're really making tremendous strides in this disease. It is true that probably at the time of diagnosis, most patients with pancreatic cancer have spread of the cancer outside the pancreas. So even if the CT scan shows only a cancer in the pancreas, in the majority of patients, and in fact, a large majority of patients, there probably is what we call micrometastatic disease, or very small volume amounts of cancer cells in other parts of the body, whether that be in the liver, the lung, or the abdominal cavity, the three most common sites. It's now fairly well studied that chemotherapy early in the course of the disease is more effective than late in the disease. And that's why even for patients with cancer that is not spread to another part of the body, that we apply chemotherapy first, and in fact, oftentimes, most of the time, do surgery last after chemotherapy and radiation. For those patients who have cancer that is no longer curable, I think in those cases, still treatment has been shown to make a big difference for those patients and their families. Excuse me. And I think one area that is oftentimes a challenge in oncology, and as you know, I'm a surgical oncologist, so I deal predominantly with earlier stage disease. And so therefore, excuse me, it may be easy for me to talk about this. And certainly the medical oncologists and the patients and their families do much more work in the area of advanced disease than I do. But it still is so important that as doctors, we provide realistic information while also providing hope. And I think that can be done. Just because a patient has a cancer that is incurable does not mean that there isn't hope, that there's hope for effective treatments, that there's hope for a longer life, and that there's hope that their remaining life will be of better quality through interaction with their physicians, with their medical community. And unfortunately, all of us are we're alone on planet Earth. We're all going to leave planet Earth. I think for those patients who have more advanced pancreatic cancer will be the cause of their leaving Earth and the cause of their death. But we can make their remaining time on Earth important, meaningful, certainly meaningful to them and their families, to all of us in the pancreatic cancer community. And the treatments and the medical teams can certainly do that. We always strive to avoid making the treatment worse than the disease. And I remember when I first got engaged to my wife Betsy, and for some crazy reason she still has stayed married to me. But I remember when I first got engaged to her, I had to go have Sunday dinner at her grandparents' house, and she's an Irish Catholic, so there always was Sunday dinner. Following which, oftentimes, and this would probably, hopefully, this doesn't happen currently in Irish households, but typically they would bring out the Jameson, and then especially the men in the family would sit there and drink Jameson most of the afternoon. So I had to go have at least one sip of Jameson with her grandfather and a few of her uncles. And I was in medical school at the time, and you know, they then had to pick on doctors. And I'll never forget what her grandfather said. He said, you know, Our mailman was diagnosed with cancer, and they treated him with something, and it didn't work. And then one of her uncles said, and my barber had the same experience. And what they were really conveying was that the treatment was worse than the disease. And for any family, they only have to experience maybe once that with medicine, the treatment was worse than the disease, for people to get an inherent bias that can happen more frequently and can happen more often than we would like. And I would assure everyone who is listening to us and is a loyal supporter of the Sina Mankiewicz Foundation that medicine tries so hard. I mean, every doctor tries so hard to make sure that the treatment is not worse than the disease, and the treatment provides added benefit. And I think if you have a feeling that that may not be the case with your physician team, I think that's the time to find another opinion, to seek out additional opinions, because we always want the treatment to provide added benefit, and we never want the treatment to be worse than the disease.